Hi there. Is this going to come out on tape this time, the audio? Take 3 or 4. Uh, I was going to say I'm trying to get into the new YouTube algorithm everybody's talking about, what, in the sense that this is something serious we're going to talk about here. And medically category serious. Uh, it has to do with the treatment of schizophrenia and the use of antipsychotic drugs. And the dangers they can cause. Well, I was diagnosed when I was 17 in Tampa at high school, and hospitalized, and but that was 1975, and then by 1979, I knew I had this neurological condition caused by the early medications. Especially the first generation antipsychotics were notorious for it. Tardive dyskinesia. It's a tardive movement disorder. Shows up later after you stop taking the drug. It covers up the damage of it, burning away the nerves from your fingers, face, and your feet daily as you take it until you stop taking it. Then the damage shows up and you have tremors and shaking. By my fingers probably shaking now on the video. I don't know. Uh, but. So, so I knew that was what fueled my psychosis in the 1980s and 90s, was the fear of tardive dyskinesia and getting it further from the medication they were still feeding me that was causing it further to become further worse. It was thought to be a permanent condition until 2018. I mean, and they developed a treatment for it, and I've been on it since 2023, I think. And September, two Septembers ago, 2 years ago, recently. But so there's nothing I can do about that except be glad they made treatment for it, because the involuntary movements are less, and the body neurology is back to normal, and uh, more so than not, most of the time anyway, was from that treatment. But and it restores the feeling in the nerves to the surface of my skin. Where too bad I don't have somebody to put their hand on there and see what it feels like to have somebody's hand on mine now. But too late in life to develop a sure treatment for that, cure for that, effectively, as long as you take the medication. Is the thing about the way medicine works. But so I have to take medication to stay well with the schizophrenia, or I'd have problems worse than I do now. But the other tardive movement disorder, besides tardive dyskinesia that you can get from schizophrenia, there's a treatment for tardive dyskinesia now, but it was always thought permanent before that. But there's also tardive movement disorders called tardive dystonia that causes scoliosis or curvature of the spine, hunchback, what it was called in early times. And there's 3 different profiles that exist for that lifelong antipsychotic use, and you develop at mid-age scoliosis or Pisa syndrome, which is like the leaning tower of Pisa, like where people curve forward, but they've got like rods sticking out of their backs, pulling them straight upwards where they had surgery, but you can't get it once you want to hunch forward with this, and you got to resist that. I've been taking creatine tea lately, and for muscle building, and it's been making a difference on uh, my back condition. It was improving a little bit. Anyway, I had my shots in my back last week too, the lower sacroiliac joint back injections, but the whole thing is that the antipsychotic drugs cause the scoliosis of the spine. So I should be, extremely effed off, by this, and I really am, but there ain't nothing point to it, because there ain't nothing I can do about it, because there ain't nobody you can sue, because the government knew all along and didn't tell doctors who were practicing write these drugs. They're supposed to understand that they're supposed to gauge people for scoliosis, like my left shoulder hanging down lower, what would have been the cue off to a doctor who knew to watch to gauge people for the right these kind of drugs for me that nobody knew. The ones currently I see when I found this out didn't know, and they were shocked. And of course, as medical professionals, because that's serious. You know, you can get scoliosis from taking these kind of antipsychotic drugs. I mean, it might be a rare amount of people who get that, I guess. I'm not really sure what the statistic was actually in actuality, but it's a lower percentage. I know that, but still, when it happens to you, it's not funny, and it's not a joke, and it's not anything you can live with easily, and it's from the antipsychotic drugs. From schizophrenia, which I can't live without, or schizophrenia would be worse than being like this. Oh, and I meant to point it out too, as I look at myself on the screen there, that my hair all was taken off by the aripiprazole added to the risperidone. That's for one profile I fit for the scoliosis, and the lifelong use of drugs, antipsychotic drugs, developing in mid-age, and Pisa syndrome, I mean, lifelong use, and the older you get. And the median age for males with schizophrenia is 59.9 or 8 or something like that. That makes me like 8 years or 7 years or so past my expiration date. I laugh. I find that sardonically funny. But anyway, 7-minute mark. We got to cut this off. So, well, the antipsychotic drugs can cause scoliosis, and they can cause heart dyskinesia, and they can cause liver damage, and they can cause sudden, unexplained death too. I mean, some of the older generation, especially, I could cause that. But so I'm just saying, you have to have this if you have schizophrenia. There's a 4th generation antipsychotic in trials testing in the Washington, Seattle area, and it works on different chemistries in the brain to treat the illness, and so there's none of this neurological damage to the brain and nervous system that these other drugs do to you. You know, when they're mixed together the wrong way or something, the right way maybe for your mind, but not for your nervous system. Okay, so your back or whatever. But so that's what I have to say. Just have a happy holiday season, everybody there. It's a holiday season in this country anyway. I guess around the world, parts of the Western world or Eastern world too, I guess, celebrate different parts of the things. Well, how far east are you talking about? Not very far east. But that's a different side of me anyway, the far eastern side of me, philosophically. So have a nice holiday season, and peace and love to everyone. Peace and love to you all. Peace and love to everybody. Have a happy holiday season.